Mesdames, Messieurs, nous voici à ce panel numéro 2, la suite.
Ladies and gentlemen, this is the second panel concerning the impact of COVID-19 in Africa, the health and socioeconomic impact of COVID-19 in Africa. Now we have Dr. Michèle, the medical director of L'Oréal France, and the Professor Ibrahima, SECK, head of Department of Preventive Medicine and Public Health, coordinator of the scientific committee of the Galien Forum Africa in Senegal. Dr. Michèle, you have the floor. Thank you very much, ladies and gentlemen. We have the honor of welcoming you in this second panel on the health and social economic impact of the pandemic in Africa that I have the pleasure of co-chairing with the Dr. Michèle Véchor, the medical director of research in L'Oréal France. We'll have two themes to be debated in this panel. The first on multidisciplinarity to advance COVID-19 response, and the second one on financing the response to COVID-19. Before I introduce the first speaker, I would like to thank the President for his support, constant support, that always allows us to make of Dakar the capital of health and innovation. I would also like to thank Mr. Bruno Cohen for his constant help. We would like to thank all the chairs and panel members that have been taking part in this, and in particular the Minister of State, Professor Awamaiko SECK, for her leadership, enlightened leadership, and the trust that she's given. For the trust she has given us, and also to the whole team of the organization commission, and in particular the scientific committee. As I said, we'll have two themes in this panel. First of all, on multidisciplinarity to advance COVID-19 response, and also the second on how to finance the response to COVID-19. The feature of this first session is that it's following a partnership that we have with Future Africa, that is an institute based in South Africa, in Pretoria, and with which we have organized a satellite event that will be shown to you in a video later. The director of the institute is Professor Cheikh, a very eminent scientist, Senegalese scientist, I may add, that will introduce the session on transdisciplinarity in order to advance COVID-19 response. Professor Cheikh, without further ado, you have the floor.
Merci beaucoup, Professeur SECK.
Thank you very much, Professor SECK. Good morning, Dakar. Good afternoon, Dakar, rather. I would like to make my salutation from the University of Pretoria. We are very much honored to be contributing to this prestigious meeting that is held in Dakar every year. I was lucky enough to participate to the first and second edition, and this year, with the peculiar context, we organized this session virtually, and it allows us to connect with the African University, and in particular the Pretoria University was very much interested in having a side event here in Pretoria. And on content, we'll talk about transdisciplinarity, and you'll see in a video that we'll show you later a series of scientific synthesis that was done on a program on COVID-19 that we've implemented in the University of Pretoria and Future Africa with the support of UNICEF, and then we'll give the floor to certain scientists that have participated in this work in order to talk about certain of the ideas that were mentioned in the videos, and then we'll have a Q&A to be able to really communicate with the participants on certain aspects that we've mentioned. Without further ado, I would like to ask the technical team to play the video that we had prepared. Thank you.
Good day and welcome to our cluster presentation for Cluster 1.1, Youth Entrepreneurship Development Skills. My name is Davi Borman.
And I am Muriel Safontaine-Jordan.
Our core program is Youth Entrepreneurship Development, with an emphasis on every synergetic element of the process, from opportunity finding, ideation, market feasibility, product development, to business setup and establishment. We take our delegates to the phase of being a potential entrepreneur to becoming an entrepreneur and following them on the journey beyond.
The Youth Entrepreneurship Skills Development Cluster pertains to enhancing entrepreneurial skills within the youth development sphere. This program is developed to enable the University of Pretoria, UNICEF, and Future Africa to scale the advantages of youth entrepreneurship, inclusive of self-employment, eventual job creation, economic growth, and higher living standards.
Our hybrid model of delivery serves as a method of training that encapsulates both synchronous and asynchronous training and interaction with our delegates. We also include ongoing online entrepreneurial support to enhance learning and to also assist with the actioning of the process of entrepreneurship. The COVID-19 pandemic created an opportunity to pivot existing business models into addressing new needs in the market environment, or to realign current business models.
My name is Dr. Osman Tumwenyeni. I am a project manager at Innovation Africa at GP. The presentation we're going to give is for food, nutrition, job opportunities, and agriculture enterprise skills training clusters. Africa has a responsibility to address the World Bank report, which was published at the turn of the century and was titled, "Can Africa Claim the 21st Century?" Countries within the African continent need to be encouraged to commit to the African Union target of 1% GDP spent on research and development. It also needs to grapple with the reality that Africa is on the fringes of knowledge production networks. In order to tackle this head-on, a different mindset is required. Professor Philip Sharp provides this counsel, I quote, "Searching for solutions to today's global challenges requires that the scientific community operate in fundamentally new ways. Developing effective solutions requires converging approaches where universities and research institutes have critical roles to play. It is essential that they develop appropriate training programs and help stimulate multidisciplinary international collaborations." For over 22 years, the Forestry and Agricultural Biotech Institute, known as FABI at the University of Pretoria, has been inspired by this particular mindset. In its quest for research excellence, FABI has been driven by a problem-oriented, team-based, interdisciplinary approach to their research, teaching, and research services that is underpinned by a wide array of technical expertise. Their scientific community is characterized by global research networks, and the research impact has also saved several millions of rand to the forestry industry in South Africa. FABI is one of the research institutes that are contributing to Africa's response to the question posed by the World Bank report that asked, "Can Africa claim the 21st century?"
Hi, I'm Stefan Deppenaar, currently a PhD student at the University of Pretoria, also the Secretariat for the Center of Study of Resilience at the University of Pretoria. It is a pleasure for me to introduce to you Cluster 3.1, Transdisciplinary Training Workshops. The Center for the Study of Resilience is known as a platform where transdisciplinary knowledge on resilience are generated as manifested in the Global South, with the aim to build existing resilience knowledge and to build human resource development in the relevant fields. The Future Africa One Hope webinar series was designed in collaboration with the CSR, which specifically incorporates the One Health concept of a collaborative, multi-sectoral and transdisciplinary approach, working at the local, regional, national and global levels with the goal of achieving optimal health and well-being outcomes. The Future Africa One Hope webinar series aims to build a collaborative, transdisciplinary research capacity of early career and doctoral students through a One Health and well-being lens. The current activities of Cluster 3.1 revolves mainly around the planning and implementation of the Future Africa One Hope webinar series. During part 1 of the Future Africa One Hope webinar series, we had a broad introduction to the webinar series. The second part of the Future Africa One Hope webinar series, we are going to engage with panels that is specifically transdisciplinary in nature. During the third part of the Future Africa One Hope webinar series, we want to specifically embrace what is being done already by early career scholars and doctoral students. We will conclude the Future Africa One Hope webinar series with developing a career in transdisciplinarity and what it entails. The Transdisciplinary Training Workshop contributes to COVID-19 research by providing a next generation of researchers in Africa with a menu of transformative competencies to address current and future global challenges in ways that mobilize socially useful knowledge. The impact of the Future Africa One Hope webinar series on emerging environment and health challenges is a community of young scholars in Africa that are connected regarding transdisciplinary scholarship and creating awareness amongst early and doctoral career scholars in Africa on a new mode of doing science, transdisciplinarity.
Professor Wanda Markotter, and I'm going to talk about the cluster UP One Health for Change that's under the UNICEF project at Future Africa. So if we really look at how our research in this cluster address COVID-19 questions, there's two parts. There's the direct research that we do on COVID, trying to improve surveillance, trying to understand the disease, trying to understand people behavior. But then there's all the indirect questions. You know, how are we going to look at food security in the future? How are we going to train young scientists, which is probably the most important thing that we need to do. So we have to look broader than COVID. We know that this will probably not be the last pandemic. So we need to really be prepared from a multidisciplinary environment to really address these questions. And we also need to look beyond just the disease. The activities that we do specifically in this cluster is to bring mentors. We equip this with training on ethics, training on communication, training on how to write better scientific publications. And this really equipped them to work in this multidisciplinary environment. It's got a much broader impact in the long term. And the focus is also to make this broader on the long term. So it's got an application for Africa. We also sitting with low resource constraints in South Africa, as in other African countries. And we need to find solutions that's going to work for our country, but also for the rest of the continent. And sometimes this is not fancy solutions. It needs to be things that's practical. It needs to take communities into account. Societies need to be able to implement whatever solutions we come up with. They need to be able to practically use the information to really make a difference in their lives.
I'm Stephanie Burton. I'm a professor in the Faculty of Natural and Agricultural Sciences at the University of Pretoria, and I am a professor at Future Africa. I'm in charge of the cluster for this program, which covers student support and cross-cutting skills, which really includes mentoring, ethics, and communication. This is a rapidly moving program, and our trainees are expected to absorb new knowledge and new skills in a short time. So the cluster has a focus on including these elements of mentoring, ethics, and communication in order for them to be able to coordinate the research that they are going to do. The mentorship program will provide our trainees with guidance from experienced and established researchers in a broad range of fields so that they will gain wisdom and they will be able to achieve their goals in their research through that guidance. The ethics training component of the program is to enable our students to learn what is internationally accepted in terms of truth and meaning and value of research, and to ensure that in this data-driven and information-driven world where anybody can find information, our students need to know that they are publishing reliable results, that they are not misrepresenting their work, and that they are not in any way misinforming the public. Science communication has been crucial in the context of the COVID-19 pandemic, and the general public need to know that the information that they are being given is true and that they can rely on it. So we wish our students to be engaging in communication of what they have been doing for their research. Through all of these programs, our students will benefit from the support of the interactions. They will become aware of their ethical conduct in their research, and they will be able to communicate and share effectively, leading to improved understanding of the many different results for the public and for the government and to inform policy. Future Africa contributes to this by being a community and a hub, a home for scholars, and a physical meeting place. It provides an environment for science leaders who share a sense of social responsibility in Africa and across the world. Future Africa has much to offer to our students and to our community. Thank you.
Augmentative and alternative communication in a health crisis. Augmentative and alternative communication refers to less frequently used modes of communication to help people with disabilities to communicate. It includes strategies and techniques like, for example, sign language, keyword signing, natural gestures, graphic symbols, communication boards, and speech-generating devices. Augmentative and alternative communication has two parts to it. It can facilitate people with disabilities to express themselves using these alternative strategies. Alternatively, it can be used as a way to assist people to comprehend information and understand information. This project was funded by UNICEF and Future Africa and involved the Faculty of Humanities, specifically the Center for Augmentative and Alternative Communication. The team comprised teachers, speech-language pathologists, sociologists, African language experts, and disability advocates. It really had a transdisciplinary approach and involved a variety of perspectives in developing the health education materials. The COVID-19 pandemic highlighted some of the systematic vulnerabilities for people with disabilities, not only in terms of their medical vulnerability, but also in terms of the accessible health information for people with disabilities. The project actually included youth with disabilities in the development of these health education materials. We obtained their perspectives using a variety of innovative technologies, such as augmentative and alternative communication, using talking mats, for example, as well as graphic symbols to be able to get their understanding. The families of the youth with disabilities were also involved in the project to provide their perspectives on what were some of the health education needs. Many of the families, for example, highlighted the need for mental health services for the youth with disabilities, as it was really difficult for them to process some of the restrictions imposed on them due to COVID-19. We also consulted with healthcare professionals that worked in the education sector as well as in the health sector regarding some of the communication needs identified for youth with disabilities.
Hello, my name is Angeline Dos Santos, and I'm grateful to have the opportunity to present the projects within cluster number 5.2, Analytical Skills on Social Dimensions of Health Crisis for Community Outreach. The projects in this cluster are situated within the School of the Arts at the University of Pretoria. They are each a response to the call within the original concept note that made specific reference to social skills for resilient communities. There are 7 projects within this cluster. The first one is entitled Shapeshifters, an arts-based participatory action study with NEET youth. That is youth who are not in employment, education, or training. Through arts processes, including musical improvisation, songwriting, drama, and visual arts, participants in the Shapeshifters project have been identifying challenges in their communities, identifying resources, creatively working on solutions, and examining what is required to sustain engagement in these solutions. The second project is entitled The Impact of Arts on the Health and Well-being of Children and Youth in South Africa. This project aims to explore the outcomes and benefits of arts-based programs on the health and well-being of children and young people in South Africa. The project will explore how outcomes and benefits are defined and described by researchers, organizations, practitioners, and service users themselves. The purpose of the study is to contribute to the evidence base and develop insight that would be useful for organizations as they develop arts-based practices that contribute to the resilience of the individuals and communities they serve. The third project is called Opening Up Empathy by Learning with Each Other. The goal of this project is to build more resilient and compassionate communities who are better able to express empathy and who can examine and shift relational systemic dynamics so as to create spaces where empathy is more likely to arise. Interactive arts-based workshops were held with a range of groups. The goal was also to explore how the concept of empathy can be communicated with a range of different people. The fourth project is entitled Creative Collaboration, using arts therapies approaches with teachers to build resilience. In the project Creative Collaborations, 3 arts therapists, a music therapist, a drama therapist, and an art therapist worked together with 9 school teachers during 4 online 2-hour group sessions. Their goal was to create a space for the teachers to engage in supportive processes directed at the stress and challenges that they have faced during the COVID-19 pandemic. The 5th project is entitled the Harfield Village Project. The study aimed to represent the spatial and social fragmentation exacted by race-based forced removal of the Harfield village in Cape Town through quantitative and qualitative data and how these shape ideas of community and cohesion. The 6th project is entitled Deliberate Practice as a Component of Grit. Since the lockdown, students have been deprived of constructive interaction and mutual support. Developing resilience and, in the long term, grit is necessary to negotiate and overcome such challenging and disruptive times. The aim of this project was to create awareness among the 12 participants in the study, all of whom are undergraduate students in the Classical Voice and Opera Studies program. Lastly, the 7th project is the Javat UP Job Shadowing Project. This is demonstrating how early career artists can be equipped through an internship in order to embark on the path towards curating art exhibitions. This project has explored how such an internship can take into account the restrictions imposed within a global pandemic. As restrictions end, some organizations do not want to return to normal, and therefore the lessons learned during such a project will have lasting importance. Future Africa recognizes that searching for solutions to today's global challenges requires the scientific community to operate in fundamentally new ways. Future Africa highlights the importance of diverse knowledge systems, new ways of living, realizing justice, and enhancing well-being. The arts are crucial within all of these areas. Each of these projects lend themselves to collaborative potential, interdisciplinary ignition, and dynamic unfolding within the country and the continent. Thank you.
My name is Cheikh, professor at the University of Pretoria, director of Future Africa Institute at the University of Pretoria. The first point which I think is important when we talk about COVID is to understand what COVID comes with, what are the causes of COVID. as many institutions are working on the scientific dimensions of the cause of COVID, the importance of understanding COVID goes beyond the medical aspect of the issue. It goes through the social dimensions of COVID, the economic dimensions of COVID, the political dimensions of COVID, and many of the drivers that the COVID has brought into the communities and people who are living in the ground. So it's very critical at Future Africa, which is a Pan-African institute to promote transdisciplinarity research, to address issues which will harness lessons for current and future crises and pandemics such as COVID. The second important point is Africa is exposed to various risks, and the COVID risk is one of them. But you have heard that the environmental risk is encroaching, and every year during the rainy season, during the dry season, so many crises happen, fires, drought. Our take into COVID is, yes, COVID is important. We try to do our best to bring the solutions. We should not forget or ignore the other risk factors which are related to our environment and our health system. And health system always comes with a diversity of aspect. It's not only medical, as I just said. It can be various aspects that require that various disciplines, various scientific, research areas come together, combine their ideas, and try to cook solutions that take into account the various aspirations and dimensions of the issue. And COVID is one of them. With the UNICEF program, what we try to do is to bring the diversity of scholars that involve a lot the young scientists to create, co-designed solutions for COVID. And I think this is the approach that will serve as a benchmark on the way we establish transdisciplinarity research in Africa. Monsieur le Président de session, Professor SECK, I will switch into English because our distinguished panelists are English speakers. So I asked the translation to be ready because I'm going to switch in English. You have seen the video, which is an abstract of what Future Africa is doing in terms of COVID research that involve, as you can see, many disciplines. You have heard things related to job shadowing, entrepreneurship, agriculture and food security, One Health, transdisciplinarity, and the issues of art and communication. So the different angles that was brought to this session was only a sample of the type of diversity of knowledge we need to establish to address the various components of COVID. So to establish this session, though, we brought some of the people you saw in the movie already to start this conversation with the community in Africa and in the world. And I have the pleasure to have among those people you have seen in the movie, Dr. Osman Melonani, who was speaking about plant health and issues related to that. We have Professor Liesel Eberson, who was not on the movie, but you have heard about webinars on transdisciplinarity, which involve a lot of young, vivid scholars in Africa and beyond. And Prof. Wanda Marcoter, who was the One Health and a big champion of responding to the medical challenge related to COVID. And we have the honor and the pleasure to have our partner also sitting in the room, Andile Dube from UNICEF. So this is the lineup, and I will try to have a quick tour de table from those people you have seen on this lineup before we start the interaction with Dakar, and if there is any question we can respond, or if we want us to keep going and commenting on the research the COVID research we're doing in University of Pretoria, we are ready to do that. So Dr. Osman, we heard you demonstrating how important is it to use technology to advance the response and to speed up the access to information to the community. And you are very community driven. So that means you went out of FABI, which is your faculty, to go and meet the requirement and the demand of knowledge that the community have during the COVID. How did you do that? Can you elaborate more from what we heard from the video?
Okay, thank you so much, Professor Mbao. I think our project had 3 components. The one component was to develop the digital tools that would then be used by the communities. So we had software engineers. So illustrating the point of interdisciplinarity or multidisciplinarity. The second component was to have young people who are undergraduates or just finished their degrees develop an infographic that ensures that we have an inclusive technology development process. You also have a situation where people are not necessarily all English speakers, and therefore the translation of that infographic of the tool is important for their uptake. And then the third component is the training of the communities in order so that they take this technology, particularly focused on plant health, use it in order to improve their profitability, their productivity into their own companies. And these range from small scale farmers to large scale, but currently our focus was on small scale farmers. And so the idea is that you don't want to go to communities and say, this is the tool. Use it. You also need to make sure that the tool is acceptable and understand what the needs are. And so that's where we are in terms of the project, understanding the needs of the communities such that we can tailor what we already have developed such that it meets their requirements and is effective. And it's not only a tool that is only used once we are there, but it's used in perpetuity and they see the value thereof.
So I'm very curious to know what was the main motive. We're talking about COVID, which is a health issue, and you're talking about food security, which is important for health, obviously, if you don't eat. But what you do think in the process that the food security is coming as a poor parent of the priority setting during the COVID? What is the motive behind your choice?
I think there's several parallels that you can find in terms of food security and COVID. Here's the parallel that I want to draw, is the fact that pests and pathogens attack plants, right, which is their host organisms. COVID, the hosts were humans. And so how these pests attack these plants leaves us insecure. Right? So if you don't have food security, you don't have a thriving economy. If you don't have healthy people, you don't have a thriving economy. So there's several parallels that you can see there. The second component is the fact that if farmers don't necessarily have the expertise that universities have at their doorstep. And so here, the driving force was, how do universities become relevant to society? And this particular project that was led by Future Africa enables us to venture into that reimagined space where universities' role and relevance is clear to society, and we partner in actually having the impact that we want to have.
I really like the reimagination of our university to respond to society needs. Thank you so much, Dr. Osman. Now I'm turning to my dear colleague, Prof. Liesel, who is a champion of transdisciplinarity. The whole session is crafted around transdisciplinarity, and every speaker have mentioned the concept of transdisciplinarity. I've seen you very motivated in having webinars where hundreds of students across the world was learning about, One Health, One Hope concept. Can you elaborate more on those aspects?
Yes, transdisciplinarity is the most natural way of being. We unlearn being transdisciplinary. Once you go to a university, once you start honing a craft, you specialized in a field, and you forget the fact that from birth throughout the lifespan, it is the issues of people, place, animal, and built environment that all matter for health and well-being. So a global challenge such as COVID brings us to a very humble space where we need to rethink the way in which we do science. It takes us out of our comfort zones of where my own background is in educational psychology, where we just need to think maybe of child development, child well-being, learning, emotions, behavior, family life. And we need to think of health. We need to think of the environment, agriculture. We need to reimagine what information technology means and how it gives us access and opportunity. And so we spoke earlier today about platforms. A global challenge provides us with a platform to think why we need to engage in transdisciplinary endeavors.
Right. Is it an easy thing to do? Because, when you elevate the transdisciplinarity to the university and higher education, obviously everybody is very, strong on his own field, and they have enough to do already in their own field. So questions such as COVID bring us to add, an additional energy should be brought into the table in order to do transdisciplinarity. What was the challenge of creating transdisciplinarity to address COVID, according to you?
Yeah, I think transdisciplinarity, to embrace that, to put on the cloak of transdisciplinarity is difficult. I think we become confident and comfortable and maybe a bit arrogant in the knowledge we have in disciplines. And then to suddenly say, maybe I don't know all of this, maybe I need to stay quiet and listen and learn, co-construct. That humility in science is difficult. If I were to ask this question to my son, who's 18, he would think I'm being ridiculous. Because transdisciplinarity for a child, for an adolescent, is obvious. Of course, people form part of all of these spaces, but we unlearn it.
I like the idea that we are naturally transdisciplinary, and we unlearn as we go through our discipline. That's a great way to put it. Thank you, Prof. Liesl. So now we'll come to, Prof. Wanda Marketer, who was also pledging transdisciplinarity. It's not often that a medical doctor, a professor in medical science, says that transdisciplinarity is absolutely important to resolve people's health. And you do that approach with the one health approach, which means a lot to many people. And it's emerging as a new frontier in science to make sure that the human health is really connected to the environmental health, to ecosystem health, to animal health, etc. And you do it with a passion of getting young scholars, academia, and making the youth being aware. What motivates you to prepare the future of One Health in Africa? Why is it so important that you address those issues in Africa?
And so I think One Health has been with us for a while. It just came more to the forefront now with COVID specifically. And I think people now really understand what One Health means, and that the human and the animal health and the environmental health is really important. And I think your question about the youth, we're going to see more pandemics, like I said. And if we don't build resource capacity, we're going to be in more trouble. And if we don't build a youth that really thinks transdisciplinary, we're also going to be in trouble. I mean, I think it's like Liesl said, it's more difficult for the older generation to understand transdisciplinary and move into that space. The younger people will embrace this. They get excited. And we had this wonderful opportunity that UNICEF funded where we could, in a very short time, bring the youth into projects. I'm a very practical person, so we decided to do small projects. And part of the requirements to get short-term funding for this was that you had to mentor young students in transdisciplinary research, not just in your own research program. And the people were so excited, the young people are so excited to be part of this. So there's really this hunger to be trained in this space that we need to embrace if we have the opportunities. And the future youth is the scientists that's going to make the difference, and that's going to find the cures in the future.
So, Prof, are you recommending that all medical schools in Africa, we are dealing with Africa, I think it's relevant elsewhere, all medical schools should have a branch of One Health right now, given the circumstances?
I don't think just all medical schools. I think all universities.
All universities.
Because One Health can't be in one school. And that's where the danger come in. If you put One Health just in a medical school, you're excluding veterinary sciences, you're excluding the ecologists, you're excluding climate change expertise, you're excluding the social sciences. So it needs to really be a focus area that needs to be embraced by an institution, by funders, because otherwise you're not going to have the money to do this type of work. So in that way, I think it needs to be like we're doing at Future Africa at University of Pretoria.
One last question. Thank you, Prof. One last question to you is that when I see One Health, I'm really away from this, but I read a lot on One Health. I think a great deal of the solutions are technologically driven. Like the health in veterinary should be medical treatment of cows for some pests and diseases, and the same in humans. So the technology is at the front line for resolving health in general, even the plant health, the technology at the front line. But we heard from the previous session today in Dakar that the socio-anthropologists, the people who are dealing with aspirations and culture and values and legacies, also can reject those technology. That's the sense you had, Osman, when you were saying they have to adopt it. In the One Health framework, what is the place of social science in addressing those issues?
Well, it's extremely important, and I think that's one of the areas we're neglecting. It's part of how funding is usually structured. Exactly. I mean, if you look at COVID, there's a reason why diseases spill over from whatever source it is. We're not exactly sure with COVID, but human behavior drives spillover, and human behavior is also going to drive the interventions and the success of interventions. And if you don't understand that, we're not going to go forward. So we need to bring in social sciences.
Thank you, Prof. Before we go to the next speaker, I think there is a question from the virtual world, Laura Bonnell, who is saying the following: I agree with you and love all that I'm hearing. Unfortunately, not all Americans believe that COVID exists due to misinformation from our current president, and not everyone masked up or has faith in the vaccine. Do you also see this problem globally, and how can we change minds and educate the public better? We have food insecurity as well, as you know. It's a general comment which shows how people perceive COVID. And in Africa, we have our own challenge of perception. I'll return that question to Lisa before I come to Andile. How people perceive COVID. We have seen relaxation in every part of Africa. And when the second spike comes in, people go back to masks, etc. At some point, so many people believe that this will just fade away by itself. What is the importance of keeping the communication and making sure people believe on this threat and behave the way they should?
Well, if we look back on what we learned from human behavior based on the HIV and AIDS pandemic, we know that knowledge did not change behavior. What changed behavior was social cohesion, not the fear of the illness, but the fear of the effects of the illness. So not the change in behavior to stop the infection, but the change in behavior to stop the consequences. So with HIV and AIDS, people did not want to leave their children orphaned, and they did not want to leave households without income. So it would be interesting to see how COVID plays out. What will stop people going into mass gatherings to socialize? Potentially not the fact that there could be infection. Potentially it could be that further restrictions will prevent them from engaging in life as usual, in leisure activities, in income generation. Yeah, so I think there's a complexity and a nuance in social, in knowledge, integration, value systems, and then behavior.
I thank you to bring that complexity, because the social value are also complex. So we are coming at the time where we have to hear from our distinguished guest of Andile Dube from UNICEF. As in the beginning of this session, we all mentioned the crucial role UNICEF is playing in establishing an ambitious program which is really thriving in Africa, what they call Generation Unlimited, because of the unlimited possibilities we have in Africa to address many of the risks we are dealing with right now. So I would let Andile from UNICEF to say a word to the community, and if there is any questions related to Generation Unlimited, which was the host of this program at University of Pretoria, we would be pleased to respond to your comments and questions. Andile, the floor is yours.
Yeah, so this is one of the most exciting programs, because at UNICEF and all the UN agencies, we believe in young people. We believe that in Africa, where majority of the population is youth is an opportunity. So if we do not resolve issues of youth to work transition, we are not likely to resolve issues of science, issues of social sciences, issues of pandemics and food security and all the related issues. if we cannot plug into the majority of the population in Africa, then social and structural changes or economic changes are not going to happen globally. So Gen U, as we call it, is a program that is basically about giving platforms for young people to thrive. It's about platforms that recognizes the power of young people and provide empowerment platforms to innovate or to unplug their potential, but to also solve the problems that exist for themselves today. When we talk about youth, we think about youth leadership development, and we think about how are we going to sort out all the individual issues or in all the social factors or all the structural factors, which when you bring all them together, create challenges, whether it's about behavioral change, whether it's about solving scientific issues, whether it's about solving social issues. So Generation Unlimited basically is about making sure that we give those young people platform. This program actually is, I mean, it's just been a few months, but we think that the evidence that has been generated in this program is likely to influence scale in other innovations, but it's also showing the power of youth, but it's also showing how we can use evidence and to inform practice and to always kill that barrier between how we would take that research and turn it into practice. It's an exciting program because young people, not just in South Africa, but in Africa and across the globe are able to pull from actual evidence of what has happened when we are sitting with someone who specializes in food security, food, and someone who specializes in social science and so on and so on. And it is located within UNICEF Education and Adolescent Development Program, because we understand that even when we are dealing with school to work transition, we have to think about youth in their different categories and how each of their individual factors is going to later influence their transition into the world of work.
Wonderful, Andile. I think because we are overshooting of time, we cannot continue the conversation, but you see the sparkling discussion happening here in South Africa. I'll quickly return the floor to Professor SECK, and to thank you again, and my warm regards to the State Minister, Professor Eva Mariko SECK, who gave us this opportunity today. Prof. SECK, the floor is yours. Back to Dakar.
Nous avons retenu pour faire COVID-19 et votre.
We would like to thank you for your contribution. You've talked about capacity building. We have problems hearing the speaker. The interpreter has problems hearing the speaker. Now, so we're going to talk about the funding by UNICEF. And this will complete all the strategies which have been discussed since morning, be the diagnosis, the care, community participation, the social impact, the health impact, and all of that. There's also the aspect of capacity building. We have interruptions. We cannot hear the speaker very well. So there's Michèle Guélaye who will introduce the next panel. Michèle, please, you have the floor.
Michèle,
Voilà,
est-ce que vous m'entendez?
Michèle?
C'est bon, là?
Is it okay?
Vous entendez?
Can you hear me? Yes, we can hear you very well. Good evening, all. It is indeed a privilege for me to preside over this session with Professor MBOW, which is indeed very important. And we have heard the importance of transdisciplinarity, and all of this information should indeed progress to lead to rapid solutions in areas such as the COVID-19 pandemic. I'd like to present to you Professor Ibrahima, who is the head of preventive medicine and public health, and who is participating in this Galien Forum Africa. I'm a dermatologist, and I am in charge of research work in Africa, but especially I am a consultant in dermatology for the black skin in the SALL hospital in Paris. Now, the first communication which we are going to have under the sub-theme 5, the funding of the COVID-19 pandemic will be given by Professor Guélaye Mamadou, president of the coordinating mechanism of the World Fund based in Senegal. Professor, you have the floor. Thank you very much, Madam Chair. Kindly put my presentation on the screen. Thank you very much. Naturally, gratitude to organizers of this forum. I'd like to thank them all, notably Madam Awa SECK, Professor Ibrahima SECK, and all their collaborators for the confidence, the renewed confidence, and the opportunity given to us to share our knowledge of funding of the response to the COVID-19 in Senegal through support from the World Fund. In terms of assigned objectives, procedures, effects, and lessons learned. Move to the next. Please. The next slide. Please move to the next slide. For this context, we are going to be as economical as possible of all time. There's just one comment at this level. There is a recovery rate of people cured, which is very high. But we have to be careful because there's a vast area of research in regard to the future of those who are said to have been cured of the coronavirus. It is not our topic for today. Our topic for today is to discuss national coordination of the World Fund, which is charged with coordinating the demands of parts of the country and the follow-up of implementation. Let's move to the next slide. Next slide, please. The next. Now, no, you went too far. Come back, come back, come back. Perhaps I'm speaking in French and the person who is manipulating is English speaking. Is there a problem? Because we don't seem to be connected. Come back to the one before this. The one which comes, yes, back, yes. Thank you very much. There are objectives. Thank you. So, we should go ahead. I should have been able to do this myself if possible. Now, as far as the objectives are concerned, it's to avoid that those who have already been affected by this pandemic should be protected, and these vulnerable groups should be protected. Now, you continue. Next. Regarding the use, it's to reduce the effects. The former, go backward by one step, please. The former, please go back by one step, the former slide. Thank you. To adapt prevention activities, protect vulnerable groups, and strengthen resilience. Now let's go directly to the procedure of use of the funds. The first mechanism, stop there, it's here. The first mechanism which was used to mobilize funding was money economized from the first phase. Simply here, there was the use of funds which were already available, but which could not be used as a result of the emergence of the pandemic. Through this mechanism, we're able to mobilize 1,700,000,000. Let's move to the next slide, please. Next slide for the second mechanism. Continue. Yes, that's the second mechanism, yes. Continue. The second mechanism, stop there. The second mechanism was a major opportunity offered by the World Fund to mobilize up to 3.25% under the NFM3 without affecting the budget for the program. This made it possible for us to mobilize 2.8 billion CFA francs. Continue. Let's go to some of the effects, some examples of effects. So in all, we were able to mobilize 3.5 billion, which was injected into the fight against the pandemic in Senegal through the World Fund. And here we have some examples of the benefits. First of all, there was the support for prevention and control against all infections in this hospital milieu. There's also support for continuous functioning of services. There's also support for communication. But very interestingly, from our point of view, there was also support for the realization of operational research on the needs of people living with HIV/AIDS and their contribution to the antiretroviral treatment. There was also support to community initiatives on sensitization and acquisition of equipment. Let us end with the lessons learned. Lessons learned. Move to the next slide, please. Yes, lessons learned. Stop there. Constraints for the mobilization of this World Fund are almost non-existent, and this is indeed remarkable as far as funding is concerned. Mechanisms for implementation was stamped on the Director General of Health, which made it possible to trace funding and a direct link between the Ministry of Health and its entities of implementation, notably the Operational Center for Management of Epidemics. And the last lesson learned is a convention with the World Fund, and once approved, would make it possible for the funds to be disbursed immediately, and they are put at the disposal of entities in charge with the implementation based on their request. So, Madam Chair, this is what I wanted to share with you. Move to the next slide, please. The next. Would like to extend our thanks to all those who contributed to these resources for the exclusive benefit of the populations of our country to fight against the pandemic of COVID-19 and to continue the fight against the three major pandemics, which are tuberculosis, malaria, and HIV. Thank you, Madam Chair.
Merci à vous.
Thank you very much.
Merci à vous. Monsieur SECK, vous voulez introduire
Mr. SECK, would you like to introduce the next speaker, please? Yes, of course, with great pleasure. Just to come back to two aspects that are very important in our opinion when it comes to this very innovative mechanism of the Global Fund. It is a funding organization that usually fund only three diseases, malaria, tuberculosis, and HIV. But with the onset of COVID-19, the Global Fund adapted in order to find mechanism to contribute to the funding, the financing of COVID-19 responses. So what we can gather here is that the Global Fund has gathered on the new funding model 2, and then when it comes to allocating with the new funding model 3, it took 3.5% of the allocation attributed to countries. This allowed Senegal to have an amount, a complementary amount of 3 billion CFA. And what is very interesting, as he has said, this funding is implemented and used by the Ministry of Health, and once the convention is signed, then you can mobilize this funding. And I believe that this is an interesting innovation, and this allows me to introduce our second speaker, Mrs. GHOSH, the president of the Bill and Melinda Gates Foundation. She has a degree in economy and international relations from the prestigious Oxford University. Ms. GHOSH, you were present from the very first edition of the Galien Forum. You are a pioneer, and we would like to thank you. The foundation has reacted quickly to support the COVID-19 response with research, but also in your assistance to multilateral agencies and countries. Could you share with us the initiatives that were taken in 5 minutes, please? Thank you very much, Professor SECK, for having invited me. This time we are not together in the car, but as we've said, inshallah, in this next edition, I'll continue in English now, in the French.
Has been fully engaged in the COVID-19 response, and we have seen it both as a health crisis and an economic crisis with so many of the partners and places where we work here in the US and in Africa and in Asia. Just to put some facts around it, you know, we have seen 20 years of progress in people coming out of poverty, increasing access to healthcare, really stopped in its tracks due to COVID. And we see for the first time an increase in the number of people living in extreme poverty around the world. We have seen significant setbacks in access to basic healthcare, whether that's maternal, prenatal care, facility-based births, immunization. And so the foundation, I think early on, made the decision, thanks to our leadership in Bill and Melinda Gates, to do as much as we could really to help manage the effects of this crisis. We are an organization that invests heavily in research and development for new tools, and equally on the delivery and the preparation for the delivery in community settings. And we engage both of those capabilities against COVID-19. On the research and development front, we worked with many partners, governments, other philanthropists, to increase the range of opportunities we were looking at in vaccines, in therapeutics, and diagnostics through a platform called CEPI, the Coalition for Epidemic Preparedness. And that, I think, has been a really significant part of the effort to fast track the development of new products for COVID-19, but also the preparation of supply for all parts of the world simultaneously, low and low middle income countries as well. At the same time, we've been working with many partners on the delivery side. And in Africa, we've been very pleased to be able to support a number of initiatives led on the continent itself. So the Africa CDC has been a key partner in dialogue with countries to prepare for the eventual vaccination and restart of health systems. We have been privileged to partner with the Africa Medical Supply Platform under the leadership of President Ramaphosa and his role as AU chair, and Strive Masiyiwa as an AU special envoy for COVID supplies. And there we've really focused on PPE, therapeutics during this phase of managing COVID-19. Of course, this is an economic crisis as well, and we have been supporting and partnering with Solidarity Fund in South Africa to provide, in its effort to supplement government programs, to provide digital food vouchers and food packets to families most hit by COVID-19. Overall, our work has really been focused in partnership with the ACT Accelerator. This is the global partnership of governments, philanthropists, health agencies, civil society, designed to bring an end to the pandemic globally as fast as possible. And that means we've been very focused on one initiative in particular, COVAX. This is the vaccination fund that is designed to pool global funds to purchase COVID vaccines as they become available. We are already seeing with great optimism, not just one, but several products coming online. We had our first vaccinations this week in the UK, and we know that over the course of the next month, significant supply will be coming online. And we see as part of the partnership, the role of COVAX to procure and work with countries to deliver COVID vaccines as fast as possible to as many population as possible. Finally, I'll say this pandemic has taken a very heavy economic toll as well. And so we are working with many partners to begin to plan for the recovery. I know in Senegal, for example, Senegal was one of many African countries that imposed lockdowns early, and therefore was able to manage the health part of the COVID crisis very well. It took an economic toll. And so how we think about economic recovery, where the money is going to come from, whether it's through debt relief or other economic recovery packages, but also very importantly, how we put the most vulnerable at the center of the recovery. Women have lost jobs and wages more and faster than men. Poor households have had less supports and less ability to navigate the economic impacts and losses of COVID. And so how we work with the community, with African governments and leaders and communities themselves to focus on women, children, essential health services, digital infrastructure to restart economies is very much on our minds as well. Once again, thank you for the opportunity.
Thank you. Thank you very much, Mrs. Gargee-GHOSH. I don't see any question for you right now, so we may go to the following presentation, and then we will have an overall discussion afterwards, if you agree. Okay, so now it's my pleasure to welcome Mr. Carl MANLAN, who is the Operational Director of the Foundation ECOBANK. Monsieur MANLAN, vous avez la parole.
Merci beaucoup. Et je suis ravi d'être là aujourd'hui parmi vous. Et je remercie
with you today, and I would like to thank the State Minister for inviting me. I'll be very brief. I think that the first element that's very important here when it comes to COVID-19 is to recognize that prevention is the most efficient financing model. If we had with questions surrounding Ebola in Western Africa in 2014, 2016, we realized that prevention in rural areas is as important as prevention is urban areas. And when the virus was spreading from rural areas to urban areas, the reaction was really more rapid. A coalition of 50 countries to settle this epidemic. To me, reliable data are really important. So having a center to prevent diseases that is efficient and well-funded is to me one of the very essential elements for the post-COVID response, so that we make sure that we are living in a better world. The last point is that we need to really think of partnership question with the private sector, the civil society as well, and the public sector. With these three entities, will find the answers for the COVID-19 response. But the most important element here is employment and how we manage to create sustainable employment on the African continent for the African youth that will represent in some years the youth of the world. And if we do not settle this question of employment, the question of health financing will not be settled either. When we receive grants, whether from the Global Fund or the Gates Foundation, tax that were on investment for employment, industry that help us to do so. So to me, to set the question linked to transforming the African continent and preventing diseases, we need to manage unemployment on the African continent. Thank you very much. Thank you, Carl Malan, for this very brief presentation, but really focused on the real needs here. So now we can give the floor to the listeners. I can see that we have 57 participants. Do we have any question? And if yes, we can give the floor to the panel so that they can ask their questions. I think there is one question that was asked for by a listener that's saying that in Mali, the population is illiterate, which is what Mr. MANLAN has said. So it's very difficult for the population to understand the danger of COVID-19. Also, there is a question on the fact that a theory on what the coronavirus is a disease for the rich and white people. So there is a conspiracy theory on that. Mr. Manlan, do you have an answer for that? I think that the perception that it is a disease for the rich is maybe how we reacted to the coronavirus or Ebola. We have taken more time to react when Ebola happened in 2014 in Guinea, and maybe this perception was linked to this element. However, in the end, when we look at our health system in rural and urban areas, the access to quality healthcare is not the same in rural areas than in urban areas. So rural areas population did not take into account the virus. I'm not sure. Maybe the virus wasn't as strong on the African continent and the number of deaths isn't the same. This has played a role in saying that it wasn't a disease for Black people. But every person that is able to communicate with their family in rural areas should pass the message and really ensure that we are not just fearful, but that we are trying to understand what is happening and how measures such as preventative measures, such as lockdowns, or having access to drinking water to wash their hands. That is a problem. If people do not have access to drinking water on the African continent, which is a problem, how can you ask people to use clear water to wash their hand and curb the spread of the disease? And this brings me to talk about, if we look at tropical diseases. I like this example because it costs 50 cents per people per year to make sure that everyone has treatment, but even that is a problem. So I think it is also linked to access to water. On a general level, it is important today that Africa takes an interest in rural areas because most Africans live in rural areas. And if we do not settle this question, the resources that we have in urban areas that are produced in rural areas, such as agriculture, how do we make sure that we return to them quality healthcare? I hope that I answered the question. Thank you. Thank you very much. I would like myself to ask two questions to Miss GHOSH. The first one is that you mentioned the purchase of vaccines.
Professeur, je ne peux pas vous entendre.
On ne vous entend pas.
Professor, we can't hear you.
Je pense que la connexion est perdue peut-être.
I think we've lost connection with the professor. Maybe, no? Hello? Hello, can you hear me? Yes, it seems that it's working now. Yes, so I was saying that I had two questions. First of all, it was on vaccines. We can see that on the international level and especially in developed countries, they are mobilized their efforts to buy vaccines. But in Africa, there is not a lot of movements. What is the position of your foundation to support African countries? We shouldn't wait until there are no more vaccines to start thinking of Africa. In your presentation, you also said that you support communities. When we look at Africa, we can see that the informal sector was particularly affected by COVID-19. And when we mention the informal sector, we think of young people with a precarious employment. And this has been even more detrimental to households. What is the plan of the foundation to help these communities? Yes, thank you very much. I'll answer in English first.
Start with your second question. You know, of course, we are here to support the plans of governments and civil societies themselves. And so what we're hearing and seeing is, first of all, just in the way of supports while the COVID pandemic is still affecting us. There's been a massive increase in cash transfers, especially effective where countries have had digital programs in place to be able to scale up digital transfers to households to see them through this very difficult period. As we begin to restart economies, we know that we will have to put informal sector employment, we will have to restart commerce and trade with a mind toward bringing women back into the labor force, getting children back in school, and that will have to be central to government policy. Of course, that economic restart depends on having everyone protected, which brings us to your first question about vaccinations. I think the purpose of the ACT-A and the COVAX partnership is precisely to address what you raise, which is this is a very complicated situation, multiple suppliers, information coming in bits and pieces about efficacy, lots of different potential sources of financing from IDA or IBRD, from Gavi. It is a moment when organizations like the AU Special Envoys, like Gavi, like the bank need to be very, very clear in their communication with government leaders trying to make the best decisions for their populations. the best advice I could offer now, two things. First of all, we know that the Gavi is the global alliance that purchases and distributes vaccines to dozens of countries around the world today. That organization has the know-how to organize this kind of international procurement and delivery campaign. They are in the process of negotiating supply agreements with almost all of the accredited suppliers. On quality of vaccines, we have to rely here on stringent regulatory authorities, on WHO pre-qualification, and on the expertise of those authorities to confirm quality of vaccines. And then I certainly will trust those vaccines. And Gavi is in the process of procuring supply. What we know is there will not be enough for everybody on the planet today. And so there will be a period of uncertainty where governments should be organizing their priority distribution processes. Start with healthcare workers, start with teachers, start with the most vulnerable populations. And that's how we will progress. I know that as a healthy person of a certain age, I will not be first in line. I will be somewhere else in the line, and that is how we should all be planning to get to full vaccination, full protection in the coming months. Thank you.
Thank you. Thank you. Il y a une question qui vient d'être posée.
There is a question that was just asked. The access to essential basic service is still a determining factor in the fight against COVID. And on top of that, African leaders have to show example in the management of resources to promote social and territorial equity. I think that that is a very complicated question. I don't know who will be able to answer this. Maybe Professor SALL. Yes, Ms. President. With your permission, I would like to first react to the question on communication before talking about governance, if we can call it that way. Can I talk on communication? Yes, of course. Thank you very much, Ms. President. In my humble opinion, there is a revision to be done on our communication approach in the health sector. In my opinion, there is a standardization and a too great uniformization of the messages, and on top of that, a lack of consultation with the population. I would like to just give the example of the promotion of breastfeeding in Senegal, for example. It was set up in certain areas, a strategy that we call the grandmother strategy that allowed us to have very positive result in exclusive breastfeeding. I think that we need to come back to our social-cultural realities and a greater implication of the population in the construction of messages. Now, when it comes to the question asked, you've said it yourself, it is a very complicated question that goes above and beyond the mere subject of the pandemic, that goes above the beyond the pandemic. I think that citizens' control need to be strengthened in our countries. And accountability, yet again, needs to be a marker, an indicator of the use of resources. And on that, I think that we still need to improve. I think that an initiative on transparency in the extractive industries is a model that needs to be transposed to governance in our countries. Thank you, Ms. President. Thank you, Professor SALL. Professor SECK, do you have a question to ask? Yes, I would like to ask Professor SALL in a minute, just 1 minute. Could you tell us, in general, the Global Fund, when they fund programs, when they used to fund programs, there was a governmental recipient and a community recipient. This time around, the COVID-19 funding has been given entirely to the Ministry of Health. Doesn't it exclude the community? Thank you very much, Professor SECK. Can I answer? Yes, this question is for you, actually. I am available to answer to this question. We wanted to strengthen the leadership of the Health Ministry through this approach, and all the other recipients, whether internal to the Health Ministry, such as the National Program Against Malaria, or outside of the Health Ministry, such as the Committee to Fight the HIV, or even non-governmental organization. They were all stakeholders in this matter. But the leadership has been given to the Health Directorate. We've set up a very strong strategy to allow every stakeholders to ensure the deployment, the optimal deployment of the intervention under its responsibility. Thank you very much, Professor SECK, and thank you to our chairwoman. Thank you. Can we still ask one question? We are at 3 minutes of the end of our session. I just had one question to Mr. SALL still for the Global Fund. I have noticed that this pandemic has touched the most vulnerable, old people and people with pre-existing condition. In Africa, diabetes and infant child obesity is increasing. So I would like to know, since we will be exposed to quite frequently to such pandemics, what are the programs that have been set up to fight these, such as child obesity and diabetes? Thank you very much to our chairwoman for such an interesting question addressed to a pediatrician, nutritionist as well, that is working almost every day in the area that is child obesity. Of course, it is a broad scope that covers lots of territory. We have 1 minute. Just to summarize, then, we need to build a practical strategy to promote healthy and balanced a lifestyle since early on in childhood, and so the focus has to be put on promoting exclusive breastfeeding and good practices. Thank you, Professor SECK. Maybe one day we'll have a broader scope in that, because it is my area of expertise. Thank you very much, Professor SECK. Thank you, Professor. Dr. Michèle, would you like to conclude? No, I'll let you conclude. So I'd just like to thank all the panelists, and first of all for Future Africa for having shown us transdisciplinarity as a new approach, and then the diversity of financing that we can have in the fight against COVID-19 in favor of the civil society, as shown by what is done by the Bill and Melinda Gates Foundation. We have also seen the private sector with the ECOBANK Foundation. And we've looked at the innovative mechanism that was set up by the Global Fund to be able to fund their response. Ladies and gentlemen, this is the end of our panel, and I would like to thank each and every one of you for your contribution. Thank you. Thank you, everyone. Thank you, everyone.